I'm thinking today about my mother. She died of ovarian cancer at the age of 53. She fought valiantly. She endured the pain and chemotherapy with grace and good humor. But I'll never forget how she spent her final months of her life. At a time when she should have been focused on getting well, she was lying in a hospital bed fighting with her insurance company because they didn't want to cover her treatment. So I know something about the heartbreak caused not just by a loved one being sick, but by our broken healthcare system.
My name is Diane Zeller. This is my beautiful champion granddaughter. I live with my children because I can't afford to live on my own. And now I'm faced with a life-threatening disease. I have breast cancer. I cannot afford chemotherapy, and I cannot afford the radiation therapy. It's just, costs more money than I have. So I've made the decision that I'm not going to do it. It's just something I can't afford to do.
I know something about the anxiety of families hanging on by a thread as premiums have doubled these past 8 years. They're going into debt at more than half. Half of all personal bankruptcies caused in part by medical bills. I know about the frustration of nearly 40% of small business owners who can no longer afford to insure their employees.
My name is Steva Stoll-Hardcastle. I'm co-owner of Companion Animal Hospital. As a small business co-owner, one of the problems that we had is providing health insurance for our employees. The husband of one of our employees who was on our plan, he got ill with leukemia, and unfortunately nothing helped, and Jeff passed away. And that was really, really hard for us because as a hospital we were a family. After that, what we saw though was that our rates really increased. It makes us have to make decisions on who gets raises and how much money we can spend on bringing in new equipment into the hospital. It really is a concern of ours.
I know the outrage we all feel about 45 million Americans who don't have health insurance. Kids who can't see a doctor when they're sick. Parents cutting their pills in half and praying for the best. Folks who wind up in the emergency room in the middle of the night because they've got nowhere else to turn.
My name is Tanya Southard. This is a hospital I work at. I'm sad to say that it's actually going to close down. They cannot afford paying for the health care of patients who do not have insurance. The majority of all of our patients here in the United States that are uninsured is that it's not that they're poor, it's that they aren't wealthy enough to be able to pay for health insurance. And so it's kind of the middle class sect, unfortunately.
Then we'll tell the pharmaceutical companies, thanks, but no thanks for overpriced drugs. Drugs that cost twice as much here as they do in Europe and Canada and Mexico.
Come here, Peanut. My name is Tom Mossholder, and I'm from Oxford, Wisconsin. I actually died on my floor and was resuscitated, and then they got me loaded on the ambulance and I flatlined again, and I was defibrillated back and was med-flighted to UW Hospital in Madison. Spent 6 or 7 days in ICU and had 2 stents put in, and I'm on about 12 different medications, and one medication, Plavix, was for a weekend supply was $461. The more you need it, the more expensive it is, you know.
Everybody knows that the healthcare system's not working. Now I know at this moment, when we stand in the midst of a serious economic crisis, some might ask, how can we afford to focus on healthcare? The question isn't how we can afford to focus on healthcare. The question is, how can we afford not to? Because in order to fix our economic crisis and rebuild our middle class, we need to fix our healthcare system too.
When Mr. Obama is president, when he becomes president, things change. Then one of the things he promises is that pre-existing is not going to be an issue. And when that happens, then I'll be able to have chemotherapy and radiation and I'll be okay. It's the only way I can think about it.
When I heard that Barack was supporting insurance companies, not penalizing small groups who had had a catastrophic health crisis occur, I said, wonderful. I'm one of those people, and so are my employees. They were hurt by that.
The last thing we needed are hospitals closing down. What we need is actually hospitals being built that can address our patients that are in need.
I think we need a new direction in our country so that the people who work their whole lives get to enjoy some of the money they work their whole lives for.
It is clear that the time has come right now to solve this problem, to cut healthcare costs for families and businesses and provide affordable, accessible health insurance for every single American. That's one of the reasons that I'm running for President of the United States of America.